breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, as always, Dr. Glenn Harrison. How's it going, big guy?
Doing good. I'm doing good. How are you on this fine evening? You said you had a little one that wasn't doing so good.
Yeah, we got some crud going around, and so yeah, we're just trying to nurse everyone back to health.
Try not to get sick yourself.
Yeah, no kidding. That's like my kids live in the petri dish because one's in school and the other one's at daycare. So it's like what one doesn't bring home, the other one will, right?
Yeah, and you're collecting it, right?
Yep, I am. Yeah. So today we have a guest on the podcast. One of your associates from out in Denver, the Denver area.
Yes.
Dr. Joey Seaforth. Is that how you say his last name?
That's right.
Yeah, guy is super knowledgeable about all things physical therapy, especially shoulder. Younger guy, super passionate about what he's got going on.
It's so true. He's all over it. When we started, we talked quite a bit off and on, and asked him if he would come on, and he said sure. And I was like, excellent, because his philosophy is really focusing on the root cause of chronic musculoskeletal or acute musculoskeletal injuries. And I think it was and he's new in practice. That's an exciting thing. There's a lot of passion, a lot of drive. He's really, really advanced. So I had a great time talking with him, and I know we went on for a little while. So here is Joey, Dr. Joey Seaforth, and he's practicing here in Colorado. Well, hello, Dr. Joey.
How's it going, Dr. Harrison? Thank you very much.
I am good. I was looking forward to this for a while, as I was just mentioning. I love your philosophy of looking for the root causes of musculoskeletal conditions and the root causes of injuries. So on this podcast, as you've seen, the world of functional medicine overlaps exactly with what you do, just in a different dynamic. So I guess maybe just start off, if you could just introduce yourself, your background, how long you've been in practice, what you like to do, where you're from, all that good stuff.
Awesome. Yeah. So I grew up southwest suburb of Chicago. My parents are still over there, New Lenox, Joliet area. I did a 4-year undergrad at Indiana State University, where I worked with a variety of athletes from all D1 sports to high school to youth. Worked a lot with the baseball team out there, started developing my love for working with baseball athletes. And then I also minored in massage therapy. Straight out of undergrad, I went to WashU in St. Louis for PT school, getting my doctorate in physical therapy. While there, I started coaching CrossFit, doing personal training, and then working with a variety of athletes, ranging from baseball, football, and basically the whole works. And then just kind of developing my strength conditioning mindset and bridging the gap between physical therapy and helping athletes alike get to that next level. And then I took a job in Kansas City area for about 1.5 years. And then while I was there, I met my girlfriend and also my dog, my puppy Shy. And all three of us just moved out to Denver about 5 months ago. So right now I'm at a out-of-network practice called TZero Physio, where we work with a variety of different athletes. We have someone who specializes in runners, pelvic floor. I work with a variety of baseball, barbell, athletes, but it's been going really well and we love it so far.
Wow. Well, that is, I didn't realize, I forgot when we chatted before that you're originally from Chicago. So yeah, that's all, coming from Canada, it's kind of like right there. It's not far away. So it creates a very tough breed of people, I would say, with weather and climate and everything else.
Oh, absolutely. Absolutely. And I'm 100% a White Sox fan. I'm not a Cubs fan. That South Side stuff is always in me.
So you guys slowly started to move to the Southwest, and now here you are in Colorado.
Exactly.
So you have a kind of a unique background. I remember you talking before to me in our business group. You were talking about you started to have a reputation in the baseball world of what were they calling you?
So in Kansas, I was Baseball Joe. So I would hold different workshops, talk with different parents, coaches, athletes, and basically just educate. And when these athletes would come in and like their parents would kind of give me a little bit of pushback saying like, oh, like I want him to play this week. And I'm like, well, your kid can't even like hold his arm against my resistance with 2 fingers. How do you expect him to throw a baseball with that much force going in the shoulder? And it's just like I felt it was more difficult when I first started out because like I was new to this, and like I'm talking to these parents that have been coaching their kids for years. But once I got the buy-in from the parents, the rest was so much easier, because once I had that one like family where I treated both brothers for shoulder and like elbow injuries, you get the coach's kid, everyone else on the team to come in, and then you have that immediate like buy-in. And I helped actually develop like J-band warm-up routines that I've been starting to implement out here as well, to basically teach the kids to warm up to throw and not throw to warm up. There's been so many times where I go to watch baseball games. These kids get dropped off out of the car. They walk, they toss their bag down, and next thing they know, they're whipping this baseball. Their shoulders cold, not warmed up. These J-band routines get them in a routine. It's 5 minutes and can significantly help them decrease like soreness and throwing related injuries like moving forward.
Yeah, I think it's interesting. So I'm not in the musculoskeletal world anymore, and definitely not in sports injury. So it's all new to me. But my mind instantly goes to how adolescent sports and teenage sports, on how an injury, and you would see this already, an injury at a young age, if not properly, I don't know, corrected, if we can use that word, will constantly create a progression of degeneration or damage. And then, later on in life, they could end up with significant trauma to that shoulder, for example, and they might never ever come out of it. They might never have full optimal function again.
Yeah. So like the thing is like the whole body is connected, right? So when someone sprains their ankle, they're just like, oh, it's just an ankle sprain. I don't really need to go in. I'll just rest it, ice it, yada, yada, all this stuff that like back in the day was huge. But what people don't notice is like when they have an ankle sprain, they start walking different, running different. They might start shifting away from their ankle when they're squatting. So like it starts with an ankle thing and can quickly turn into like a right ankle sprain, left knee pain, low back pain. And they're constantly wondering like, well, I haven't changed anything. Like, I don't know what it is. It's because you haven't addressed the ankle, and the problem is just working up the chain. And that's the common thing that I think is really, really missed in like the PT world with a lot of different people. They get so hyper focused on the ankle. So they're giving just balance exercises or like 4-way ankles with a band and this stuff, but they're not correlating it to like watching them walk, watching them run, watching them jump. And it's so simple just to grab an iPad, get like a basic movement screen, show the person, see where they have deficits, and to work on those deficits to look at the bigger picture. Because if you're focusing just on that one area, you're missing a whole lot of different stuff. And I like to give this analogy too. So if you basically think about the body as one bucket, right? 100%, you have different percentages for different body regions. So like, let's just say for your ankle, you have 10%, right? So like 10% of your brain's focus is on that ankle. When you have an ankle sprain, your brain has to take over and put a little bit more percentage to that ankle. So maybe now from 10, the longer it goes, it turns to 25, 30. The problem with that is it takes away different areas that the brain could focus on, like the knee, the shoulder, the hip, like all these different stuff. And this could also help, like, this could not help. This could also like lead to other injuries and other overuse things because the body's not moving in the most optimal positions.
So if something it happens, injury happens, and then body mechanics change, and gaits change, all of that. If it goes on for too long, you could end up, maybe you had one problem, but if it goes on for too long, I guess what you're saying is you could literally end up with 5 other musculoskeletal problems if it went on for too long because of that one original problem.
Correct. And like what the thing is too, it's like someone might come in with like, they've had shoulder pain for 3 years. They've been to multiple PTs. They've done all this stuff. They've tried dry needling, chiropractic, physical therapy, whatever, massage. And it's because the root problem wasn't addressed. And oftentimes, like, I'll be working with someone, their shoulder's getting better, they're getting stronger. And then they're like, hey, like, my shoulder feels great, but I'm having left knee pain. And it's like your knee pain was probably already always there, but your brain was so hyper focused on your shoulder because you constantly would have pain. You couldn't sleep on that shoulder. You
Mm-hmm.
know, you regret it. And what tends to happen with people when they have these chronic like conditions, right? It's they come in and I could see it on their face. Like I had someone like last week come in with low back pain. And before I even told them to reach down to try and touch their toes, they were already telling me with their face that this was going to hurt. So I stopped them and I'm like, what's going through your head right now? They're like, oh, I know this is going to hurt. I'm like, do you have any pain right now? They say, no. I'm like, then why do you know it's going to hurt? Oh, well, it's hurt me the last 3 months. So what tends to happen is I learned very quickly that their brain is taking over for their body, right? So their brain is telling them that something's going to hurt before they even do it. So when people are like this, they're stuck in this sympathetic, fight or flight nervous system, right? They have the jitters, like heart rate's higher, blood pressure's higher, they're not getting as much sleep. And my job that first day is to educate them, explain that, stress the importance of diet, sleep, all the buckets that you can control that kind of help, and to teach them like, hey, like we have to desensitize this movement. Maybe today you can't touch your toes, but maybe we do like a hip hinge work, like a hip hinge exercise, or like something where you're initiating it right before you feel that pain, so we can kind of keep desensitizing that. Because I feel like a lot of clinicians, they'll go right to the back, they'll try Graston, they'll try dry needling, they'll try all this stuff. That's cool. It might change the perception to the brain, but if they're still worried about bending over to touch their toes, get that laundry basket, pick up their kid or grandkid, it's never going to change unless you address that like desensitization.
That's right. So it turns from a peripheral pain issue or sensitization. It actually turns into what we call a centralized, meaning,
Yep.
cord brain, where you end up with this feedback loop in neuroplasticity, where it takes less stimulus. Just the thought of it creates the hypertonicity, creates the muscle firing, and then it just goes and goes. I never thought of that, but I like that you're aware of that, and it's and body language. It's you see everything, and I think you're kind of dialed into, well, without a doubt, you're dialed into how pain plays into emotions, right?
Mm-hmm.
The fear of what if things get worse, but pain triggers a memory. Well, this in clinic, because I see it myself with what I do. People have a hard time to remember when pain goes away, but they always remember when it comes. And there's a reason for that. So that's a kind of an evolutionary piece. If we put our hand on the campfire, we
Right.
realize, oh, that's hot. We pull away. Immediate response. And by learning that, we protect ourselves, we save ourselves. And with these kinds of pain syndromes, two things happen. We become hypersensitized, hyper aware of it's going to happen, and it starts to change your behaviors, change your actions. And then the other thing that happens is we remember it so well, but we forget when it disappears. So I like that you're paying attention to all that. So briefly, I know this is a big piece. I don't know if we can really, if it's not a straightforward question. In the world of shoulders, it's the most mobile joint in the body, right? The shoulder is the most mobile joint in the body. Yeah, it's highly prone to injury, even outside the sports world. What are some of the areas of problems, if there was two or three major areas of dysfunction with a shoulder? If we're just looking at shoulder, nothing else going on in the body.
Okay, so most common things I see with the shoulder is like that anterior pain right here, or the superior, or like on top there. Most of the time, I'd say like 70% of the time, someone's coming in, they have that anterior shoulder pain, right? So they've all these diagnoses. They've had impingement, rotator cuff tendonitis, biceps tendonitis, like bursitis, like all this wonky stuff. They come in, they're like, yeah, like I had this MRI, it shows all this stuff. And I tell them the first visit, I'm like, hey, like that's cool that you got the testing done, but like imaging does not dictate pain or function. I'm
That is
like,
so true.
I want to know like what can't you do? I can't lift my shoulder above my head. Okay, let's mess with the shoulder blade. If I put them in like a posterior tilt, so if their shoulder blade is just sitting forward, if I pull them back and help open up that space and help allow that upward rotation, that shoulder blade, how's it feel? That feels better. Okay, boom. So now I know that one of my home programs is going to gear towards something that puts them in that position that allows them to like learn it. Okay, now let's test strength. let's test your external rotation strength. So basically, can you push out against my hands at the at your sides and then at 90? No, ooh, that brings on the pain. It's like, okay, so we're starting to find a weakness thing. So we have a positional, we have a weakness thing. Now let's check out the nerves. Like, let's take them through some neural tension. Ooh, like that one really lights it up. I'm getting stuff down in my hands. Okay, try it on the other side. I don't feel anything. Okay, so we have a neural tension component, right? So I'm just basically teasing out all these different things, and then I build my game plan off of that. But a lot of times, if you could imagine, like, got a tennis ball right here. So if you imagine like a golf ball on a tee, right? That's our shoulder joint. And we have 4 rotator cuff muscles, and it always cracks me up because people always call them rotary muscles, or like they always have like a different name for them, right? And like you have these 4 muscles, right? You have your supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles are all on the shoulder blade, but they attach to the shoulder on the side and also the front, so they control it. So what people tend to do is, like, I get like these baseball athletes, right? They come in, they're throwing, they strain something. They're throwing, they're having pain. They're having weakness. They're having all these different things. And what tends to happen, instead of that golf ball being centered on that tee, it moves around. And if you ever look at, like, for you, for example, you've seen this, but like one of the biggest things that I do with people that have shoulder pain, I pull up an anatomy app. I pull up the shoulder, I add all the bursa, the connective tissue, the muscles, like tendons, all this stuff. And I'm like, all right. I'm like, what does this look like? They're like, looks like a lot of crap. I'm like, exactly. It's a lot of different stuff. So I'm not going to sit here and tell you that it's a bursa problem, it's a this problem. Like, I care more about function. Let's calm things down. Let's get you in better positions. Let's educate. Let's get you moving in the right direction, get you stronger, and let's see how you do over time. And like, just showing people that, they're like, you know what? I've been to 7 different orthos. No one's even sat down and explained the shoulder to me like that. I've learned from YouTube. I've learned stuff like that. Another key thing I always ask that first day, right, is like, the patient comes in, I'm like, what do you think is going on? Because that question can tell me so many different things. I've had that question where I ask it and you can just see the person balling up and they just lose it. They crying. It's like, okay, so now I know today's going to be more, if anything else, even if I don't put my hands on the person, today's an education day, right? Mm-hmm. We're going to get through that. Let's get that buy-in, and then let's keep building off that. I had a woman who was told she didn't have ligaments in her neck, that she should never, like, all these different things. And like, she's like, I don't even know what to do. And she had 3 surgeries lined up before she worked with me. And she had one that was coming up in 2 weeks. She's like, yeah, they told me to try PT, but like, I've tried everything. I'm like, you know what? Push back that surgery a month. Give me 4 weeks to work with you. And the difficult thing was, is I was moving to Colorado, and I had to like break the news to her and like let her know, like, hey, like, I'm only going to be here for 2 more weeks, but I'm going to give you another provider that's going to crush it with you. Before I left, she was 75% better.
Wow.
75% better. And I was not doing any mind-blowing stuff. It was just education piece, telling her, hey, it's okay for you to do these different things, because she was, she
tightened right up.
Doing everything. And like, she, nervous system was just so like, ticked off and all this stuff. And it's like, that's how you have to know what you need to focus on that first session. Because I tell people, I'm like, I could have 10 shoulders walk in tomorrow. They could have 10 different like individualized plans, because maybe someone needs mobility, maybe someone needs neural stuff, maybe someone needs a lot more strengthening, and it's all like client specific,
That's true. And you're hitting on a great thing, the communication aspect of it, right? Because people shouldn't have to, and I get this a lot in clinic as well, people shouldn't have to YouTube their symptoms to try to find an explanation of what the hell is going on, or YouTube their diagnoses. Because there's so much, and I heard this phrase from a patient one time: diagnoses, adioses, and it was so accurate, and it's so sad too, because if someone is just given a diagnosis and said, okay, you can't do this, and this and that, and you have a bunch of word vomit diagnoses, and this is we can send you in for surgery, but don't do all of these things. We'll talk about the loss of hope and optimism and any kind of empowerment that they could have. Well, you see it every day. People are crushed. People are absolutely crushed. And I don't want to take away from, maybe the diagnosis is accurate. Maybe there should be limitations for X, Y, Z, but it shouldn't be just the standard. This is it, and there's nothing you can do about it. And suck it up, Buttercup. We're gonna, get your orthopedic surgical consult, and that's it. I love that you're able to connect with people and look at function. Even when I was talking about my own challenge, my left knee, and say, well, doc, you probably don't need to go for a surgical consult because it's not to that level. However, we're going to find out where the weaknesses are. We're going to find out where the imbalances are, and we're gonna start correcting those. So I love that you focus on function, because I in my clinic, I'm Dr. Kolby as well. We're always looking for root cause, and a lot of times there's a diagnosis associated with that. But does that mean that's the end of the road? Never, not once, not once. So I love what you do. I love your philosophy. You're relatively new in practice, and I think if you're already this advanced, oh my goodness, it's going to be exciting. So I'm very excited for you, really. And I hope that I hope that more physicians like you are able to do what you do and keep that philosophy. So I guess to wrap up here, how can if you can briefly walk us through, if someone's in the area, right? Someone's in the Colorado area. I'm going to say Colorado because people shouldn't have any problem driving 6 hours to see you. I don't even, that doesn't fizz me at all. If people are in the Colorado area, or I don't know, Western Nebraska, and they want to come see you, what does it look like? What does it look like at this point in time? So someone could be watching this video in 3 years, it could change, but at this time, what does it look like, the walk in, and what does that case workup look like?
Yeah. So basically, you can go to our website, TZeroPhysio.com. You basically schedule an initial consult. You find a time that works for you. We do 90-minute evaluations, and then all follow-ups are 60 minutes. They're all one-on-one, so you're always going to be working with the same provider. Like I mentioned before, we have a pelvic floor specialist on staff. So like anytime that I have someone coming in who I think would benefit from seeing her, they'll work with me for a few sessions, and then we'll kind of do a coach read where they see her for a few sessions. So we kind of like, come together and mesh all of it. But basically they find a time that works with like any of our schedules. They schedule a 90-minute evaluation. They come in. If we're looking more like lower half, like back, like I always like to assess someone's gait, right? So like I take the iPad out, watch them squat, lunge, walk, do some single leg balance, anything else that like I feel like is relevant to their thing. If we're dealing with shoulders, I might have them wear a tank top, or for males, shirt off. I'm like actually drawing on their shoulder blades for a reference, and we're actually recording, and I'm showing them like all these different things, because the one thing that's really missed in this profession is like nobody records anything. Yeah. You could do something and I could tell you it, and like you could just nod your head, or I could record you and you're like, holy crap, I'm shifting that much to my left side, right? So we go through that, and then as we go through our session, like I go through the education piece, I'm showing them anatomy, I'm talking about our stuff. We go through our treatment for that day, and then basically I break it down into 4 pillars, if you will, right? So we have our pain reduction, basically calming things down. If it's a nervous system thing, we're giving some neural like glides, like whatever we need to do to like calm things down. Next up, we have retraining, basically getting them moving better. That's where we're starting to mix in mobility, strengthening exercises, the classic PT exercises that you will, right? Yeah. Now, the big thing is a lot of places will stop here, right? Oh man, like you can move your back, you're out of pain, great, see ya. What tends to happen is like these people go out on their own, on their own, and the problem stems back, right? Because they just got the basic level. So then we like our next phase, that's the third one, is the big 5. We're looking at strength, power, mobility, endurance, stability, like all these like different things, right? And that's where like, someone's getting back into like a workout class type thing. That's what our session is going to look like. I might put you through like an EMOM where 1 minute you're doing this exercise, the next minute you're doing this, or we're getting that heart rate up, we're putting you under a certain stress, and we're seeing how you do. And how you do with that can be honestly your program for the next like couple days, couple weeks, whatever. And then our last phase is chaos. So we brought up the shoulder analogy, right? Let's say we have a CrossFitter who's got that anterior shoulder pain, and they're like, what does a chaos stage look like? I'm like, chaos stage to me is you could do a workout where you might be doing kipping pull-ups. You might have some clean and jerks, like push-ups, whatever. You can have the woodworks, you can go through it. And by the end of it, you can walk over to me because I'm probably going to be in the class with you, right? And you're going to tell me, I can't even tell I had shoulder pain. And I'm like, great. You keep going with that, because that's the phase that we need to get like a lot of people to. A lot of people try to get them to prior level of function. BS. Prior level of function is the reason why they got in there. You need to get them ready for whatever the world can entail.
That's so
And
true. Yeah.
quick note, I had we talked about this a little bit ago. So I had a patient in KC. He was a retired police officer, had a brain tumor, was told never to squat because his back was the back of a 90-year-old, never to squat, same thing with his knees and all this stuff. Within 3 weeks, we were doing all that stuff. And he was doing it under like fatigue. Like we were doing stations and all this stuff, and literally like changed his entire life around to the point where he would come in. He's like, you know what? I know this is going to be a goal for like a long time from now. He's like, but I want to get back into running. And I'm like, great. Like, let's do it. Like he's like, I want to get back into like, whatever it is. And then you just work backwards, right? It's like, hey, you want to get into running? Okay. You have to be able to do all these things. So let's just check all these boxes and let's get you there.
That's so awesome. That is so awesome. Really what you're doing is you're teaching people how to take care of themselves so they can pursue the passions of their lives and get out of pain. And, so many people lose their lives, or you see it because of pain, or they lose their lives because they can't pursue their passions. So I love that you focus on that. I'm really excited to see what the new stories that you're going to have in the future, and hopefully we can have you back on. So
absolutely, I'm looking forward to it.
So thank you for taking the time. I love your passion. Keep doing what you're doing, and hopefully we can get you back on soon.
Absolutely, and just a shout out to Dr. Harrison here. This guy is so knowledgeable. Me and my coworker went there to go see him, and he takes out a sheet of paper and he's like, what do you guys want to learn about today? And he said thyroid, and he just off the top of his head, boom, he's drawing this chart. He's doing all these things like different medications, how it affects it, and all this stuff. And we were both blown away how he could just come up with the top of his head. So we have plenty of people that we're going to be sending to you, and I think you're actually talking to one of my clients at 10 o'clock today. So,
oh, wow. Okay.
it'll be a fun conversation. It's the one that I kind of talked with you about in the parking lot a couple of weeks ago, but
yeah,
I'm excited to get your perspective and just and that's the thing in this field, right? It's like, you don't need to do everything on your own, right? You should have a team of people that you can reach out to. So like Dr. Harrison is like the top of our list, right? We can just refer to like people that we need to. And the other thing that you always mention is like, you can get blood work done, or you can get blood work by you that looks at everything and like just like gets to like the root of the problem, and then you can actually build a game plan around that, because I feel like so much stuff is missed by standard care and healthcare, right? Like, you go to you get the standard thing, these standard exercises might calm it down, but it doesn't take away the thing. Same thing with you, right? You see a lot of people that like, you're probably not the first stop for a lot of people. You know what I mean? Like people have been put through the ringer and it sucks. So if they could find like people like us earlier on, it could save them a lot of trouble and like get them feeling better quicker.
Yeah, think outside the box so you can actually take care of the true problem, so you can again fix it and move on with your life. But we shouldn't have to think about our symptoms and our pain and navigate through that on a daily basis. We should be able to overcome it and be able to think about enjoying life, and that's what we want to do. So anyway, I better run, but I appreciate your passion, and I look forward to the next time. Okay.
Yep. Sounds good. Thank you for having me.
Thank you.
How awesome was that?
That was good. Yeah. He's all over it. For as early as he is in practice, you just don't see that level of insight already. Like that, it's like he has all decades of clinical experience, and he's already kind of dialed into it. So I really, really like that. I think some of the major takeaways that I got from it was the insight to pay attention to, and you work in the musculoskeletal model as well. I don't, but the attention to the patient's demeanor when asked to go through a certain motion and catch them, already bracing for pain or maybe already experiencing pain before they even truly have it, like via neuroplasticity.
Yeah, his observational skills seem like they're pretty dialed in. I do think it was interesting as well when he was talking a lot. In fact, when I was watching the interview by myself, because I wasn't present at the actual time that you did it, I think that he had some insights that are really applicable to like the practice that I have set up myself, where he talks about, your pain, and maybe he didn't phrase it the same way I would, where all that patient's brain is really, really aware of what that pain is, the pain, the region, the range of motion that pain is happening in. Well, in my world, that's just negative neuroplasticity. You know what I mean? So it's really interesting to hear it from the other, from a different provider that doesn't have the background that I do, but they're still seeing the same thing.
Yeah, it's seeing it but interpreting in a different way.
Yeah, absolutely. I think that he would, if he was interested in it, getting into this type of work would be super gratifying for him, because you can help a lot of people doing that too, and he's already halfway there because his observational skills are really good. So, yeah.
And the other thing that I thought was really interesting is how, when I asked him how he starts working with patients, and there's different tiers. I never thought of that, and really was kind of an aha moment for me is how a lot of physical therapy, the goal is to take people to, and I can't remember, you might remember exactly what he said, to like pre-injury status.
Mm-hmm.
And he said, that's garbage. That's garbage, because that's how they got to the injury in the first place.
Yeah.
So getting him to go in through, as he keeps training and conditioning, getting him to go to that chaos mode, I think he called it,
yeah,
where they could absolutely do everything. And it's not just getting them back to the status quo before the injury,
right?
But it's actually preventing them from getting into another injury, building
right.
confidence.
I mean, if you're able to adapt to whatever life throws at you, I think he actually said that at one point. He's like, I want you to be able to handle whatever, whatever life throws at you, whether you decide to, go downhill skiing, or you want to play basketball, or you want to get into powerlifting, whatever it is, you have the ability to do it. It's really cool. Cause I think that a lot of times it's like, okay, you're not hurting anymore. You got good range of motion. See you later. Well, that's not necessarily
that's
the
not
case.
the real, that's
No.
not the real life situation.
I also thought it was super interesting too, because his model is so similar, even though it's a completely different like practice. It's all musculoskeletal. We do a lot of like, functional medicine, functional neurology type stuff. His view on it is really similar to ours, and I thought it was he was a perfect fit to come on today, because I think that people can,
yeah, that's exactly what I thought. Where he's kind of dissecting the problem, and instead of just focusing on the diagnosis, as I said, diagnoses, adioses, but
right.
but doing what he can and what they can to restore function, so people can kind of move through their life in a pain.
Right, and even seeing the body as the body, not right.
That's right.
So it's not an ankle injury. It's like, okay, how is this affecting everything else? It's kind of the same thing with whatever your metabolic syndromes or neurological symptoms. Like, it's not just going to be isolated to one area. It's going to impact everywhere. So
yeah,
it's super cool, super astute guy.
So I'm really excited to see what he's gonna, what the stories are gonna be in the future. He said he'd come back on again, so I'm looking forward to that. So if he's listening, yeah, you're coming back on again, Dr. Joey. You've been voluntold.
Yeah.
So anyway, yeah, if anybody is in the area, whether that's anywhere in Colorado, Western Nebraska, or Western Kansas, yeah, you can Dr. Joy's contact information will be below. You can reach out to him. I don't know how many questions he can ask, but funnel them through, and we'll get them to him, and we'll get him on again.
Yeah. And as always, if you guys have questions for us, you can reach out to us at info@brainstormingwiththedocs.com. You can get a lot of information from Dr. Glenn's website. His is drgharrison.com. You can get slightly less information on my website, which is northlakeschiropractic.com. But again, if you guys have questions, suggestions, feel free to email them to us, and we'll check that. We check that pretty frequently. And again, we appreciate the likes and subscribes, and turn on the notifications, because we continue to roll out this content as we get it. So until the next one.
All right. I look forward to it. We'll talk soon.
All right, buddy. All right. Bye-bye.